I am Dr. Rashmi Devaraj, consultant neurologist associated with Apollo Hospital, Jayanagar since almost 5 years now. At Apollo Hospital, Jayanagar, we offer a range of treatment for many pediatric disorders, childhood neurological disorders, and specifically I'll be talking about childhood-onset epilepsy. Epilepsy is a broad term in children and the causes can be innumerable. The age of onset of seizures can range from day 1 of life till as old as they can be. So here we help in offering diagnosis about the seizures. For example, what are the types of seizures that are occurring in children? So you can have multiple varieties. They could be just myoclonic jerks. They could be just blank episodes, which we label them as absence. They could be frank episodes of generalized tonic-clonic seizures, or it could be secondary to the focal onset with secondary generalization. For example, the eyes can deviate towards the right side, followed by a facial twitching of the right half of the face, and right upper limb followed by the right lower limb, and then the child can lose consciousness. In such a child, the seizure is mainly arising from the left side of the brain. So why is that arising? So in these children, we'll have to evaluate for that. We do EEGs, find out where exactly the epileptic activity is arising from. For example, in this child, most likely it will be arising from the left side. So if it is arising from the left side, what is the cause? Whether it is because the child has not cried immediately at birth and suffered a perinatal insult, because of which there is a damage to the left side of the brain, and that is causing seizures to appear from the right focal seizures, or is it secondary to some tumor, a benign tumor that is growing in the brain, or if the seizures occur all of a sudden in a healthy child and multiple seizures are occurring continuously in a span of few hours or few days, whether it's secondary to what we call as the autoimmune encephalitis, or it is because of if the child has had fever and then presented us with altered sensorium, having a right-sided focal seizures, whether it's secondary to the brain infection or inflammation. Infection could be secondary to herpes, where the seizure, the virus could have infected the left half of the left temporal part of the brain. So there are many causes that we'll have to evaluate, especially in children who present with epilepsies. So they can be secondary to the perinatal insult, where the insult has appeared on day 1 of life. It can be certain things called as inborn errors of metabolism, where there are certain deficiencies, or the genetic disorders where the certain amount of enzymes or certain products are not being produced in certain quantity, or abnormal products have been produced, where we'll have to screen these children with respect to tandem mass spectroscopy, urine for abnormal metabolites, get a genetic analysis done, whether it's a treatable condition or a non-treatable condition, what is the prognosis in these children, how to manage them further, and what are the specific anti-epileptic drugs. See, there are more than 10 to 15 anti-epileptic drugs, and everything cannot be used for all types of seizures. So a specific seizure would require a specific type of medication. So the diagnosis of the epilepsy in terms of the causative agent, the age of onset, the type of seizure onset, whether there's a family history, it's secondary to certain metabolic disorders or mitochondrial disorders where valproate is contraindicated. So all these will have to be analyzed and diagnosed appropriately. And then it just not ends with the diagnosis. The management depends upon prescribing the specific medications, getting investigations like EEG, MRI, certain other blood tests, and they have to be monitored regularly, because some patients will require monitoring of the blood levels if there are side effects. Some of them can develop rash to certain medications, where then it has to be discontinued immediately, or it can become life-threatening. So, and the children should come for periodic assessment, and whether they are adhering to the drugs regularly. And based on the children, especially in children, the weight and height increases every other month. So then the dosage of these medications has to be adjusted appropriately. So all these will have to be considered. In addition, counseling the parents and assessing the scholastic performance in these children, the others behavioral issues. Some children on certain medications can become aggressive, can have exhibit violent behavior. So that in addition also will have to be managed. So childhood onset epilepsy is a broad spectrum requiring immediate and early treatment, recognition first and foremost that it is a seizure, and people go to so many other places before coming to us and it would have been delayed by the time we start the treatment or even make a diagnosis. That needs to be avoided. Early the treatment is started, better is the management and better is the prognosis, and counseling is a part of these diseases.